Hello, I'm John Heritage, Senior Lecturer in Bacteriology at the University of Leeds. I used to be a clinical scientist before entering academia, and what I want to tell you about is the history of infectious diseases. From the dawn of civilization, we've exploited microorganisms without appreciating their effects. Microbial products have improved food safety and its storage immeasurably, and a single species, Saccharomyces cerevisiae, is responsible for the leavening of bread and the production of alcohol, hence its names. Depending on your interests, this is either baker's yeast or brewer's yeast. Plague. Our early understanding of microbiology was hugely influenced by infections. Of these, perhaps one of the greatest influences on the history of the Western civilization has surely been wrought by the plague, caused by the gram-negative bacillus Yersinia pestis. Mycobacteria may have influenced fashion for a short period when high collars were worn to hide the lesions of scrofula, and syphilitic lesions were also disguised with makeup during the 17th century. Yet plague held Europe in a devastating grip during the Middle Ages and well into the 17th century. Bites from the fleas that live on black rats transmit Yersinia pestis from infected animals to humans, particularly in conditions of poor sanitation. In Elizabethan England, for example, during episodes of plague, measures were taken to warn inhabitants to keep the channels against their houses free from filth. Furthermore, they were advised not to make dunghills out of the stables in the streets. Ticks, lice and bedbugs have been shown to act as vectors of plague, but spread other than by the fleas is rare. Fleas gorge on the blood of an infected rat. They thus acquire the bacteria circulating in the bloodstream of that rat. Bacteria multiply within the flea gut. If rats are not immediately available, then humans will provide an alternative supply of blood. The flea can then inoculate the human victim during a subsequent feeding session. The most common form of plague is bubonic plague. The site of entry may develop a pustule or carbuncle, but this is not common. The infection localizes in the lymph nodes, causing them to swell. Subsequently, bacteria spread around the body. Patients suffer a high fever and prostration, consequences of septicemia or blood poisoning. This is accompanied by a rash as the blood leaks from damaged blood vessels into the skin. The lymph nodes turn black as the surrounding tissue becomes affected, first by an area of hemorrhage, and then, as the oxygen supply is diminished, the tissue dies and blackens. The affected lymph nodes are referred to as buboes. The Black Death ravaged Europe in the mid-14th century, killing approximately 1/3 of the population of Europe, although some communities were wiped out entirely. The plague recurred periodically with varying degrees of mortality, hitting a new height in the 17th century. In London, the Great Fire in 1666 has been used to explain the disappearance of the plague in that city, but this is thought only to provide a partial explanation. Plague was quickly associated with insanitary conditions, and for many years it was thought to be spread by a miasma or noxious cloud. People believed that the harmful effects of miasmas could be prevented using nosegays or bunches of flowers. Hence the image of Dr. Beek of Rome, one of the classical images of the plague. One positive outcome of the Black Death was Boccaccio's Decameron, the collection of stories that 10 friends told to each other over 10 days in a country retreat, trying to escape the infection in Florence. The birth of microscopy. Although the means by which the plague was spread was not recognised in the 17th century, indeed, there was an order to kill all cats and dogs in London in 1665 in an attempt to stop the spread of the infection, a measure that exacerbated rather than ameliorated things. This was the time when microscopy was born. The Dutchman Antonie van Leeuwenhoek was the principal pioneer of microscopy. In England, Robert Hooke was a foremost practitioner. Considerable advances were made in understanding the microscopic world, but not everything that was seen has stood the test of time. For many years, people believed that spermatozoa were tiny humans, complete in themselves, that buried into the womb to develop. These were known as homunculi. The problem of infection. To ensure their continued survival, it is necessary for microbes to find a suitable habitat, exploit that habitat and multiply in numbers, and then disperse to a new habitat that suits them. At first sight, it would not appear to be in the best interests of the long-term survival of an organism to destroy its habitat. Thus, it is at first sight surprising to find that microbes cause so many potentially fatal diseases. However, more careful consideration of the idea that species do not destroy their habitat is not necessarily true. Climate change is currently well up the political agenda, but there have already been disasters following human behaviours. Agricultural practices in the American Midwest during the early part of the 20th century led to the formation of dust bowls in what was formerly prime agricultural land, so perhaps life is more complicated than it first appears. For a pathogen to survive, it is only necessary for the pool of susceptible individuals to be large enough and the rate of transmission from a diseased individual to a susceptible host to be high enough to maintain the microbial population, without being so high that it diminishes the pool of potential hosts. Given these parameters, it may not be so surprising that microbes cause disease, even those that are potentially fatal. This is particularly the case if one considers that many of the manifestations of infectious diseases may help to spread the agents of infection. For example, viruses spread in infectious droplets of mucus formed during the act of sneezing, and bacteria responsible for gastrointestinal infections spread in diarrhea. Intoxication. Intoxication is a special case of microbial disease. Foodborne microbial illnesses caused by bacteria such as Staphylococcus aureus and Bacillus cereus and Clostridium botulinum, and aflatoxin poisoning associated with the fungus Aspergillus flavus result from accidental ingestion of the metabolic products of these microbes. While staphylococcal food poisoning and intoxication caused by Bacillus cereus is relatively mild, botulism is frequently fatal, and aflatoxin is a very powerful carcinogen. An extreme example is the hallucinogenic effect of ergot, derived from the rye fungus Claviceps purpurea. Is this the reason for Celtic and medieval illuminations that are entirely bizarre? Ergot is easily metabolized to release LSD. The intoxication suffered by humans plays no part in the life cycle of these microbes. Thus, intoxications represent a very special class of microbial disease. In most cases, microbes and humans interact directly with each other to produce disease. The degree of microbial interaction with humans is highly variable, and in no way can we use it to predict the outcome of particular infections. Let's consider just 3 bacterial diseases, all of which are potentially fatal: cholera, dysentery, and typhoid. In cholera, the causative bacterium, Vibrio cholerae, infects the lumen of the gut, where it elaborates a powerful toxin that causes dehydration via an osmotic mechanism. Patients die simply as a result of water loss, and tissues taken at post-mortem appear normal even at the microscopic level. This represents one step closer to microbial intimacy than is seen in microbial intoxications. The next stage of intimacy may be illustrated by bacillary dysentery caused by Shigella dysenteriae. In this disease, bacteria infect the intestinal lumen. They then damage the lining of the gut, colonizing, then damaging the subepithelial layers. Again, there is fluid loss, but because of the damage to the subepithelium, patients also experience bleeding into the gut, resulting in the bloody flux. The ultimate intimacy is illustrated by Salmonella typhi. This bacterium is ingested and infects the host through the gut, but it is capable of surviving inside host cells and causes a systemic infection that involves many organs. Horizontal versus vertical spread. There are 2 fundamentally different ways in which microbes can spread from one individual to another. Most common is the horizontal spread, where individuals infect one another by normal contacts, either directly or via animate or inanimate vectors. Second type of spread is vertical spread, where parents infect their offspring. Vertical transfer of microbes leads to congenital infections. Endogenous versus exogenous infections. The chain of infection described previously is similar in many respects to the development of the human commensal microbiota. We have always lived in intimate association with our microbial partners, even Adam. They must find on us microenvironments that they can exploit and ecological niches to occupy. Here, the successful members of the commensal microbiota will flourish to form our residents. These microbes must evolve to avoid the innate and adapted defences which we protect ourselves with. Our commensals may protect against infection. Antibiotic therapy may disrupt the gut microbiota, leading to pseudomembranous colitis caused by Clostridium difficile or Clostridium difficile, which cannot compete with a competent gut microbiota, but which flourishes when the gut microbiota is disrupted, causing a potentially life-threatening diarrheal illness. Socially, we may find some of the effects of our commensal microbiota unbecoming. Cheesy feet, body odour, and flatulence are all instances of the unappealing effects of our microbial residents. Furthermore, we live in a state of dynamic tension with our microbiota. The microbes are continually probing our defences, and we are constantly trying to protect ourselves from their invasion. When one of the indigenous microbiota gets into the wrong place, the consequences can be disastrous. A dramatic example of microbes in the wrong place is afforded by the oral streptococci. These bacteria elaborate extracellular polysaccharides that enable them to stick to the surface of our teeth. When we have a diet over-rich in sugar, these bacteria may help to initiate dental caries, but otherwise they do little harm under normal circumstances. Dental procedures, or even vigorous chewing on toffees, for example, permits oral streptococci to gain access to the bloodstream. Once they have entered the blood, they are disseminated throughout the body. If the host has a previously damaged heart valve, then the same extracellular polysaccharide that enabled these bacteria to stick to the surfaces of teeth now enables them to stick to the surfaces of the heart valve. There, they will be covered in a layer of fibrin, and this protects the bacterial cells from the host defences, initiating bacterial endocarditis. Thus protected, the bacteria will multiply on heart valves and will be protected by further layers of fibrin that grow to form vegetations. These grow to such a size that they further impair the function of the damaged heart valve. Fragments can also break off and lodge elsewhere in the body as so-called septic emboli. These can then initiate infections at these remote sites anywhere in the body. If bacterial endocarditis remains untreated, then the condition is inevitably fatal. This provides one spectacular example of an infection caused when a member of the commensal microbiota gets into the wrong place. Such infections are referred to as endogenous because microbes come from within the body. Most urinary tract infections are also endogenous. Perhaps this is most graphically illustrated by the condition referred to as honeymoon cystitis. Young women who have recently started engaging in sexual intercourse are particularly susceptible to urinary tract infections caused by the skin commensal Staphylococcus saprophyticus. The anatomy of the female urogenital tract conspires with the mechanical activity of intercourse to inoculate the usually sterile urinary tract with the staphylococci. Once they've gained access to the urinary tract, bacteria multiply to cause the irritating symptoms of cystitis. With endogenous infections, the first encounter with the host typically occurs considerably before entry to the site that becomes the focus of infection. This is because the agents of endogenous infection form part of our commensal microbiota. When infections come from other people, they are said to be exogenous. The length of the incubation period varies from a few hours with infections such as those caused by food poisoning strains of Salmonella to weeks or months, such as, for example, with hepatitis B virus or some mycobacterial infections. Routes of spread of infection. Exogenous infections involve the spread of microbes from one individual to another, and microbes have evolved numerous strategies for accomplishing this. Some pathogens are better at this than are others, and some sites are more vulnerable to infections than are others. To illustrate this, how many of your friends have had a cold or flu in the last year? How many have had food poisoning in the last year? Or within the last 5 years? How many of you have ever had cellulitis? Ever? The mode of spread of infections is also of significance when discussing the ease of microbial dissemination. One person with a cold could infect a very large number of people in the immediate vicinity of the victim. Respiratory infections spread by infected droplets thus have enormous potential for spread. Other infections are not so easily spread. Infectious mononucleosis, or glandular fever, is caused by the Epstein-Barr virus. This is shed in large numbers in saliva. It is frequently transmitted from person to person by kissing. Consequently, glandular fever is most commonly seen in adolescents and young adults. Venereal disease, such as gonorrhea, requires sexual intercourse between individuals for the infection to spread. As such, the scope for spread of venereal infections through a population is somewhat limited, and it also requires at least a degree of sexual promiscuity. It would, however, take a prestigious lover to infect as many people as are infected by inhalation of infected droplets. So, in summary, understanding of the infectious cycle may indicate how it can be broken. Infections can occur from endogenous or exogenous sources, and their methods of spread are numerous and diverse. We will probably have infectious diseases as long as humans exist. Human behaviour doesn't always help in the battle against infections. The microbes that live in and on us are constantly probing our defences. When we protect one portal of entry, microbes evolve to exploit others.